SNDT College of Arts and SCB College of Commerce and Science for Women, Mumbai, where she has been since 2017. Her doctoral research focused on the politics of Hindu right-wing organisations in Western India, and among her publications are a monograph on the life of a Scottish Indologist entitled Peter Peterson, and articles and book chapters on women and religious nationalisms, and more recently, indigenous sports in Western India. Her current project, that she is partly going to be discussing tonight, engages with received histories of smallpox eradication in India through investigating the series of pilot studies that India conducted prior to the launch of the WHO's Global Eradication Programme. So I invite our first speaker up to the stage, and we will change over our PowerPoint slides.
Thank you, Claire. Thank you, Claire. Thank you, Claire, for this introduction. And I want to thank my hosts at Namrata University for arranging this event, and also for being very generous in helping me plan the whole arrival and settling down. I've called my presentation Rereading Success and Failure in the Indian Smallpox Eradication Programme. I'm sure some of you here are familiar with this image. This is the cover page of World Health, which declared the eradication of smallpox, and this was the May 1980 issue. This was a very important issue, also because it declared the eradication of smallpox, and explaining this important program, it was also an example of global health cooperation, and smallpox eradication became an important reference point for discussions on future disease eradication programs, determining which diseases were suitable programs for eradication, or whether disease eradication itself was something that was feasible and a wise thing to do. It was a big story then, and it continues to fascinate people even today, not least because of smallpox association as a possible weapon in bioterrorism. How do we know the smallpox story? We have institutional histories of eradication, the big red book. Some of you are familiar with this one. There is the CDC account on eradication. And apart from this, we also have a lot of participant narratives. Narratives where heroes are talking about the eradication saga. So you have oral histories, you have memoirs, autobiographies, and biographical narratives talking about the hero's role in smallpox eradication. We have Henderson's account, we have Isaiah Arita's account, and so on. In all these accounts, different geographical regions or countries feature as chapters. And India, almost always, is an important part of the story. To return to World Health, that's an issue that I will return to several times during the talk, there were several articles on India. And why was India important? That is the focus of my presentation here today at York, as well as the focus of my research presentation here, as well as the focus of my research at York. India was a difficult region. It was a region of great social, religious, and geographical complexity, a very huge and a mobile population, also the biggest reservoir of variola major, the deadly form of the virus. In 1951, 250,000 cases were reported, of which 64,000 led to deaths. Half of these were in India. A decade later, in 1963, over 80% of the smallpox were in India, of which 75% resulted in deaths. Apart from this infamy, interestingly, India also has another credit because this was the first place when prophylactic vaccination was introduced. The first vaccine was sent by Edward Jenner himself and used in Bombay in 1802, and this, of course, is just an important piece of trivia for us. How do we know the India story? There are books, institutional histories, and participant narratives. The most important, of course, is WHO's account of smallpox eradication in India, which I have christened as the Big Blue Book. It's a slightly modified version published by the Southeast Asian Regional Office, and you have that in the center, which is the Green Book. Nevertheless, as a practicing historian, I cannot help but emphasize that not all voices are represented in these histories. Some, as we all know as historians, are marginalized. And I'll just point two examples to prove my point. This is Dr. Nicole Grasset, a very charismatic French-Swiss epidemiologist. And she was important because she was in India right from 1971 to the end of the program, but we hardly have any account written by her or her role inscribed into official institutional histories. The other important institution that is largely neglected is the SIDA, the Swedish body, which gave a huge loan of $19 million towards the end of the program, which has been acknowledged as generous, flexible aid, which meant this was aid with no strings attached. But yet we have nothing which gives a very detailed account of smallpox, of SIDA's contribution to the smallpox story. The other problem with institutional narratives is that they are oversimplified. They present a unified picture of eradication. They do not reveal to us the complexities that are involved in any kind of policy making or decision making. And here I would like to draw your attention to an important book that was written and published by Dr. Sanjay Bhattacharya called Expunging Variola. Bhattacharya's book is important because it challenges these unified celebratory narratives, and more than anything else, it demonstrates that the WHO program was not simply a top-down, Geneva-directed program, but there were a number of negotiations that happened at the regional headquarters level, there were negotiations that happened at national level, and various kinds of officials had to be cajoled and convinced. The program, as it unfolded across different regions, had to also carefully integrate local knowledges of field workers, people who were actually on the field, and this contributed to the overall richness of the program. Bhattacharya also emphasizes the importance of tapping various voices of workers in languages other than English, using sources which are primarily archival, correspondence, documents, and all of this which indicate the kind of policy making that was involved in this process. Some of these nuanced arguments provide a springboard for my own thoughts about India and fuel my own research. I argue for a careful and longer view of the entire Indian National Smallpox Eradication Programme, which began not in the 70s, as is generally believed, but in the 60s. I would like to submit that India's early efforts at smallpox eradication are inscribed into the official narratives as a prelude to the actual successful program of the 70s. A victorious standpoint crafted when the disease had been defeated envisions all earlier history as that of failure, and it is this that this project seeks to challenge. I draw your attention to these words written in one of the official publications. It points out that the definitive strategy which was responsible for eliminating the disease, here smallpox, in northern parts of India was implemented only in October 1973. Indeed, in another interview that has been uploaded by the CDC, this is Center for Disease Control America, a key Indian official concurs that India's smallpox eradication was remarkably short, swift, and effective. The obvious reference here is to the mid-1970s campaign. Such selective recounting seems to overemphasize a few years and tends to erase all previous history of India's India's engagement with smallpox. More importantly, this narrative undermines the role and significance of painstakingly created medical infrastructure, which did not spring up overnight in the 1970s, but was a result of sustained efforts for over a decade. It is even more startling when even serious academic works on health in India dismiss the Indian program as inconsequential, still boosted by foreign funds and expertise. And the person I'm referring to here is Roger Jeffrey. According to this perspective, Indian story would just read thus. So in 1966, there is the famous declaration made by WHO, followed by arrival of foreign medical officers in 1971, and in a jiffy, smallpox sort of magically disappears from India. So what was the National Smallpox Eradication Programme? And I would say a few words about health planning in India and the Indian scenario in the 1960s. In the 1960s, India had a population of 400 million people, and there were 15 federated states. Now there are 29.